Hey everyone, I'm Shannon. I'm a professional counselor here in Louisville, Kentucky. Thanks for joining for our Ask Anything series this week. These are questions that have been submitted by you guys, and we're getting them answered by mental health and wellness professionals. So today we are here with Callie Weiss. She's a licensed clinical social worker. She runs her own private practice called Callie Weiss LLC. In her practice, clients and families find super healthy options and being able to navigate the challenges and the changes that they want to see in their lives happen with compassion and empathy and all kinds of support. Callie sees clients currently via telehealth, but she'll also transition back to office-based sessions soon. And the services that she provides include individual and family therapy sessions. And she does have a Facebook page that you can learn more about her. It's her name, Callie Weiss, LLC. And she also has a Psychology Today profile. So if you pretty much just Google her name, you will find that and you will be able to be connected with her if you're interested in learning more about her services. But today, our question for you is, I'm concerned that my therapist has so many clients that they're not going to be able to have time for me. How do I know that I'm really going to be focused for and cared for by my therapist?
That is a very good question. And I think it's not one that a lot of times people even express to their therapist at the beginning. I think it's something that they kind of hold kind of close to themselves. And I really think that it comes down to making sure that you feel comfortable with your therapist and that you have a relationship with your therapist. Um, we therapists are human beings. Sometimes we do get stressed out. Sometimes we are distracted. Sometimes, even in the building itself, there can be distractions. There's distractions in our lives. We don't feel well. There are numerous reasons that you may feel that your therapist is not giving you the attention that you need. And the first thing I say is just kind of talk to them and say, I'm worried that you're not going to give me the attention that you need. If you feel also that you would like to see your therapist more often and they're telling you things like, well, I don't have anything for 2 weeks or 3 weeks or 4 weeks, and that's not what you feel that you need, it is a conversation to have with your therapist and say, I feel like I would like to see you more often. And if they can't provide that, one of the best sources of referrals for new therapists sometimes is your current therapist. And we are grown-ups. We are human, but we are also grown-ups. We can, one of the notes that I put down, we sometimes, just like everybody else, we kind of go about our business and kind of go about treatment. And if we don't get feedback, if we don't hear it from people, we just kind of go along. And so it's really important to communicate your needs, and it's in a safe space that is 100% focused on you. So I just want to encourage you to have those conversations. The other thing I really encourage is that you don't just stop going to therapy. If you feel that your therapist has too many clients and can't see you, or is distracted too much and can't see you, I really want to encourage you to not take that as, well, therapy is just not working for me, and just not go at all.
Yeah.
I think that that is what a lot of people do. And it is, I want to acknowledge also that it is very scary sometimes to say, I'm not getting what I need, especially if that's one of your treatment goals, is to learn how to speak up for yourself and say, I'm not getting what I need.
Yeah, very well.
Um, but I also want to, we are professionals, we are humans, but we are also professionals. Our drive in life, most of us, we became therapists because of who we are and what we kind of tend to be, as far as those qualities of empathy and compassion and really unconditional positive regard. So we want to encourage our clients to practice that advocacy for themselves, speaking up in this nice, really comfy, safe space that's just for you.
Yeah.
And so if you are not feeling that, have a conversation. If you feel that, I would say that the initial feeling of, I think that they may not have too much time. Um, if we offer you, a weekly, that means that we have a weekly appointment to give you.
Mm-hmm.
If we don't, and you want it, talk to them about it.
Mm-hmm.
So it's that twofold. If you want more and aren't getting it, communicate. And if you start to feel also that maybe I'm doing a lot better, I want to see if I can kind of go on my own a little bit and have a little bit more time. Talk about that with your therapist too.
Yeah.
Sometimes I have reasons that people come in and they say, well, I think I'm done. And I'll say, well, why don't we, do a month or do 2 months, and we kind of ease it off.
Mm-hmm.
But your treatment as a client always belongs to you.
Yeah.
I am not, as a therapist, it doesn't really belong to me. I simply try to guide. And I do have specific trainings in how to help people with certain specific problems. But your treatment as a client does not belong to me as a therapist. And therefore, I want to make sure always that I tell you. I tell all my clients up front, if this isn't working for you, let me know.
Mm-hmm.
Sometimes it's scheduling. I've had that also, as a side note, where, excuse me, somebody will start off and say, hey, I have noon appointments available, and that works great for me. And then all of a sudden they're like, well, I changed jobs,
Mm-hmm.
and now I can't meet you until 5 o'clock. And that may not work for me. It is always a conversation about how can we make it work?
Mm-hmm.
Do we need to find somebody else? I feel like I'm a pretty cool person and a lot of people get along with me, but I am certainly not necessarily unique in my personality traits, how I run my practice, the trainings that I have.
Mm-hmm.
I am definitely not some sort of unicorn that is a rare find. So I feel like I, can always help people find other therapists that might meet their needs. It is always about you trying to find what meets your needs,
Yeah.
and it belongs to you.
Yeah.
So I think that really is the core of it all for me to provide for my clients.
Yeah, I love
So
that. And I love how you mentioned, what you do in your practice, and a lot of other therapists do that as well, is like, we'll open the conversation for you of saying, hey, I'm not going to be the best fitting therapist for everyone, and you're not going to be the best fitting client for everyone. So let's work together, use our communication skills to figure out if we're going to work together or if we can refer you to someone else who's going to fit your needs. And it's not that therapist is saying something to you because they feel like you're not a good fit for them. They're just putting it out there as a blanket statement that this is something normal in the mental health field.
mhm, mhm, mhm.
Very cool.
Yeah.
Yeah.
Sometimes for families, I will also put this out, that sometimes it's a really good fit for the parents, but it may not be a good fit for the kid.
Yes.
And it's also really important that that the kid feel engaged, because the treatment belongs to the child, even if the parents really kind of appreciate everything that I'm doing for them and genuinely feel that they are progressing. But if the child is the client and they're not progressing, then that's also a time where we have to have that difficult conversation of, there might be somebody else out there that's really going to meet their needs better.
Yeah. Well, thank you. Is there anything else that you'd like to leave our audience with, just as a tip or trick or anything mental health related?
I think right now, one of the biggest things I've been saying just lately is that we all just need to have a little grace for ourselves and a little grace for other people. Grace is really just that word. I mean, I feel like it's even more nuanced than empathy or compassion. It's really just this space and allowing people and allowing ourselves to understand that sometimes our behavior and our emotions lately are not going to be what we would like for them to be, would not, and are not. what they usually are. Um, Pandemics and politics are a really strange combination that we did not think that we were going to be in, but I know that people are feeling them very acutely. So
Yeah,
take care of yourself, I think, is my big thing.
very much. Yeah, care for yourself in all the ways. Um,
Yes.
Thank you so much for spending time with us and answering this question. I know that individual is going to love this answer and be pleasantly surprised. If anyone else has a question that's listening, DM us. We'll get it answered by a mental health and wellness professional. But until next time, have a good day. Thank you.
Thank you. Bye-bye.